Hello, I'm Robert Yates from Chatham House in London. South Africa recently committed itself at the United Nations to achieving universal health coverage, whereby everyone receives the health services they need without suffering financial hardship. What countries across the world are realising is that the only way you can reach universal health coverage is through a publicly financed health system, where healthy, wealthy members of society cross-subsidise services for the sick and the poor. This is something that South Africa could easily do, and it is perfectly affordable because the country is already spending 8% of its GDP on its health system. The problem is, half of this is being spent through inefficient and inequitable private insurance schemes. Were these resources captured in a public scheme, you could achieve universal health coverage. And this would bring tremendous benefits to South Africa, not only in terms of the health benefits with people living longer, it would also deliver economic benefits, stimulate economic growth and create employment. And most importantly, what countries recognise, it's an extremely good way to maintain peace and stability in the country as well.
I'm very pleased to have the opportunity to address South Africa on the occasion of UHC Day 2019. This year's theme is Keep the Promise, a theme that is highly relevant to South Africa as it is to many other countries. UHC is fundamentally about equity. Can everyone get the services they need of good quality and without fear of the financial hardship that may accompany that, regardless of their income, regardless of their race, regardless of gender, regardless of any other social differences? UHC is sometimes proposed as a kind of utopian vision of everybody getting everything for free. That's really not what it means, and it's not what we mean when we talk about UHC. We try to make it practical, and one way of thinking about this practical issue is to recognize that every country has some degree of underlying social inequalities. Some, like South Africa, have them to an extreme sense, others much less so. The real question about UHC, then, is does the way that the health system is organized and function actually serve to mitigate those differences, or does it reinforce and make them actually worse? Now, in South Africa, arguably, the architecture and mechanisms by which the system is functioning actually makes the inequalities wider. In South Africa, we know that about half of overall health spending is concentrated on the 16% of the population that has private medical scheme coverage. Such coverage is highly correlated with income, and in a sense, the system arrangements work to concentrate spending on behalf of the better off. And ultimately, this is the problem that the NHI reform should fix.
Friends and colleagues from South Africa, I am delighted to speak on the NHI UHC. For the last 30 years, we have invested in making service available at primary health care by having district hospital and health center in all sub-districts and all districts throughout the country. So that primary health care is the foundation for implementing UHC with a good outcome in terms of equitable access. At the same time, parallel reform is to introduce financial risk protection, start with the poor, the low income, the vulnerable population by providing free service, and then gradually extend coverage to private sector employee. And lastly, we achieved UC by 2001. Strategic purchasing, in particular application of capitation and DRG costs under the global budget, is so critical in ensure efficiency in resource use and cost containment in the long run. So Thailand experience can be learned, can be shared with the global audience. In particular, our fellows from South Africa who is going to implement NHI in recent years should be aware of strengths and weaknesses at country level in implementing UHC.
The World Bank congratulates South Africa on the ongoing efforts to implement the National Health Insurance, a reform that aims to move the country towards universal health coverage. The reform also aims to tackle a problem that has persisted for a long time: a two-tiered health system where the public sector and the private sector serve the poor in separate health facilities with significant differences in terms of access, quality, and outcomes. Achieving universal health coverage is a core part of the World Bank Group's agenda to invest in human capital and reduce extreme poverty. It is in accordance with this agenda that the bank supports South Africa's bold vision to roll out the NHI reform. South Africa spends a significant amount of money on health, yet the population continues to suffer from preventable illness and premature death. While it is acknowledged that there are other factors outside the health sector that influence unfavorable health outcomes, substantial improvements can nonetheless be made in the sector. Countries such as Mexico, Chile, and Thailand, which spend a comparable amount of health per capita, have achieved much better health outcomes. This is also possible for South Africa. The NHI reform is made more urgent by the disproportionate burden faced by poor people in terms of maternal and child health outcomes and communicable diseases. They also suffer disproportionately from non-communicable diseases. Successful reform of the sector through NHI implementation will make a substantial contribution towards correcting some of the historical imbalances where primary level health services were underdeveloped and systematically underfunded. Systemic health system reforms are never easy. However, other countries have shown that they are possible. They've done so by translating a vision into concrete and incremental steps and adopting an approach of real-time learning and course adjustment. As you move forward, the World Bank stands ready to support you, Honorable Minister of Health, Dr. Zweli Mkhize, the National Department of Health, the government and people of South Africa to see the successful implementation of the NHI become a reality. Thank you.
Universal health coverage is a global phenomenon where all countries have committed through the United Nations to make sure that all their citizens have access to good quality health care with minimum financial risk. In South Africa, we call universal health coverage NHI, and the intention is to equalize the difference between the public and private health system so that patients will have access to good quality health care through the same system. This can be done through a single pool of funds that purchases healthcare services for all South Africans, which will then improve the quality of care that all South Africans receive.